If you're looking after a stroke survivor at home, and you may have become aware or heard the terms trigger point, chronic pain, contractures, but don't understand fully what those terms mean, then this video will explain everything for you. Hi there, I'm Dr. Kenneth Monaghan. I'm a university lecturer and a neuroplasticity expert. I'm also the author of Lights, Mirrors, Action, a guide for transforming the lives of caregivers and stroke survivors. I'm hugely passionate about trying to adapt a stroke survivor's home to become an ideal place for them to carry out their rehabilitation program after they've had a stroke. Now, if you've had a stroke, I recommend, and most therapists would recommend, that stretching is introduced into your daily program. So stretching of the upper limbs, stretching of the lower limbs. And the reason that you stretch on a regular basis is that a number of things happen when you don't stretch. So one of the things that happens is that your tissues, which could mean muscles, could mean tendons, could mean ligaments, could mean the capsule around your joints, all of those tissues are often, people sometimes call them sinews. Those tissues will actually start to tighten up if they're not moved on a regular basis. Because you're not moving the materials in them, you're not actually pushing the components of the muscles past its ordinary resting length. So the first thing that often is mentioned is that a trigger point is a sensitive area within a tight muscle, and what happens is that when a muscle is not moved on a regular basis, sometimes it can develop these little spasmy areas that are very painful to touch, and those areas are called trigger points. And these points become much less sensitive and less painful when that limb or that muscle is stretched out on a regular basis. So again, you're going to be explaining some of this to your stroke survivor. So if they've heard the term trigger point, that's what it is. It's like a sensitive area within a tight muscle, within the fibers, and it forms in a muscle that is not moved on a regular basis. Second thing that happens when tissues are not stretched out on a regular basis is that the tissues themselves, they become shortened in almost a permanent way. They shorten and they tighten, and this leads to what people call a contracture, or the permanent deformity. And you often see this, I've seen this over the years, when patients sometimes are bedridden and they don't, and the stretching for their calf muscles and for their ankles is not done on probably a regular basis or enough to stop the development of these tightnesses and contractures. You find that the foot then is not able to move past a 90-degree angle, or sometimes the toes are actually permanently held in a plantar flexed positions, so that when the person tries to walk, if walking was attempted, then it's almost impossible. It's very difficult. So contractures occur when tissues are not stretched out on a regular basis. And then the final thing that happens, which a lot of people would not be aware of, is that if I didn't move my shoulder for a couple of weeks, apart from the fact that my tissues, the muscles, the sinews, everything around it would get tighter, I also would start to notice that my shoulder was very painful, because tissue that's not stretched out on a regular basis actually develops sensitive areas. And the tissues, so all tissues in our bodies have what are called proprioceptors, or little detectors, that send information to our brains on a regular basis. So every split second that we're alive, our proprioceptors, our detectors, are sending information up to our brains just to tell us what's going on in our bodies. And when that's not happening, or when those receptors are not stretched out the way that they normally would be used to, as well as getting tight, it manifests itself as pain. So that's why stretching is just so important. Even if it's only moving on a regular basis, it stops people from developing chronic pain. And what I've noticed over the last number of years is that in Ireland, and I've even seen my wife get involved in yoga classes that have become hugely popular. And I've read really good research over the last few years about how yoga is very beneficial for stopping or preventing chronic pain development in patients. And it makes sense to me, because when you're moving and you're stretching the tissues in your body, you're desensitizing these trigger points. you're desensitizing, you're stopping the development of this chronic pain. So it makes perfect sense. So caregivers, you need to educate your stroke survivor about the benefits of flexibility and the benefits of stretching on a regular basis, so that you can motivate your stroke survivor to actually continue doing these stretches and doing these as part of the 3 hours that they're needed every day. So if you found this information useful and beneficial and you'd like further resources, then go to my website, www.lightsmirrorsaction.com, and there you'll find some extra resources that will help you alongside of this information about stretching. There's some good videos there that show you how to stretch the shoulder, the elbow, and the wrist, and explanations for the exact technique for how you carry that out. So thank you very, very much for listening, and we'll see you in further videos.